this could indeed be airborne to a greater extent than 3 feet, to a greater extent than somebody coughing and sneezing, which, of course, in terms of airline travel, is crucial. No flights have been cancelled so far, despite the fact that France, the United Arab Emirates, Britain, and other countries have cancelled flights as a result of this Ebola outbreak in Africa weeks and months ago. Now, flight attendants and border patrol agents in America are being told to watch for signs of Ebola, despite the fact that I saw a case on CNN the other day where the CNN reporters who had been in Liberia openly stated to border control, to the flight attendants, that they had been there, they need to be checked for potential exposure to the Ebola virus, potential symptoms. The Customs and Border Patrol agents, according to these CNN reporters, were not interested. So we've had the CDC saying for months that they had this under control, that it wasn't a threat. You know, Obama said it was very unlikely there would be an Ebola case in the United States. And it appears they've been caught with their pants down completely unprepared for this. They failed to deal with it when it sprung up in Dallas. Now we've got a new case in Hawaii, a potential new case, and we're going to go to a local news clip about that now.
Joe, health officials say they just found out about this possible case this morning, and they do not want the public to be concerned.
We are early in the investigation of a patient, very, very early, who we are investigating who might have Ebola.
State health officials confirm tests are being conducted on a patient who remains hospitalized. The Hawaii Nurses Association said the person is being treated at Queens.
It's very possible that they do, that they have Ebola, but I think it's also even more likely that they have another condition that presents with similar symptoms.
Dr. Melissa Veray said the patient could have a number of illnesses, including Ebola, flu, malaria, and typhoid. She wouldn't tell me any symptoms the person was having or if the person had recently traveled to West Africa. But she did say a big red flag of Ebola is a fever and recent travel to that area. Why is this person being isolated?
So again, when we've asked the hospitals to tell us about, is anyone with a travel history and anyone with a fever, and when those two come together, we've asked them to be very careful and in an abundance of caution while you're working them up for whatever else might be going on. Also make sure you isolate against Ebola just in case that is the case.
That's
so
a
it sounds like
out of Hawaii, a potential new case of Ebola. Not confirmed yet. As I said at the beginning of the show, we're also tracking a case in a different state where a health professional, a medical worker, claims that there is a case that they're about to announce in a completely different state. So if that's the case, it would bring us up to a potential of 3, but only 1 confirmed so far, of course, in Dallas. But he potentially exposed up to 100 people or more to the Ebola virus, mainly because he went into the hospital on September the 26th and was turned away, was given antibiotics, despite the fact that he told hospital workers that he had just flown in from Liberia and that he had the symptoms associated with the onset of Ebola. Here's an article out of The Guardian. US Ebola patient told staff of Liberia travel but was allowed to leave hospital. So our initial understanding of this was that he didn't tell the nurses, the hospital workers, where he had come from. They didn't ask. That was obviously the first faux pas. But now we know that he actually told them directly he had come from Liberia, yet they still asked no questions whatsoever, gave him some antibiotics, and sent him on his way for a further 2 days after he had already been in Dallas since September 20th. And again, no questions asked. We've also got this out of CNN Health. Hospital dropped the ball with Ebola patient's travel history, NH official says. The first person to be diagnosed with Ebola on American soil went to the emergency room last week but was released from the hospital even though he told staff he had traveled from Liberia. A travel history was taken, but it wasn't communicated to the people who were making the decision. It was a mistake. They dropped the ball. And that was very apparent in the press conference yesterday, where they deflected basically any questions about how this was allowed to occur, how this patient was allowed to wander around Dallas for a period of days. We're going to be back after the break with more Ebola news. Also switching gears into other topics. Going to take your calls, 1-800-259-9231. David Knight coming up, second hour. Lionel, third hour. Alex Jones Show live, Infowars.com.
You heard the discussions
Up on Infowars.com right now. Rand Paul, political correctness hindering scientific decisions on Ebola outbreak. And he says, quote, "My suspicion is that it's a lot more transmissible than we've been told." So this ties into the warning from the UN head that it could have gone airborne. Now we have Rand Paul complaining about political correctness and that hindering the CDC in being able to deal with this Ebola outbreak. Also saying that it's possibly a lot more transmissible than we've been told, which is developing into a common theme. We also have this article out of Reuters. Dallas Ebola patient vomited outside apartment on way to hospital. So we know that he was taken to the hospital inside this ambulance, which was then used for 2 days afterwards, potentially exposing other people, health workers, to the Ebola virus. Also, it came out yesterday, I believe, that this individual, Thomas Eric Duncan, first contracted the Ebola virus, having helped one of his family members back in Liberia into a taxi. I believe it was a pregnant woman that was stricken with Ebola. He helped her into a taxi back in Liberia. There's the article out of the New York Times. US patient aided pregnant Liberian, then took ill. So, I mean, it almost certainly he knew that he would contract Ebola having done this. Then he flies to the United States almost immediately to get treatment. And I've seen questions being asked for the people who can afford it. Obviously, the hospitals in Africa are completely overwhelmed by this. People who turn up for treatment fearing they're an Ebola victim get turned away. We've seen videos where people are just hanging out the back of ambulances. They can't even make it into the hospital. No one's really helping them into the hospital because they don't have any beds available in those West African countries, Liberia, Sierra Leone, and others. So the question is being asked, you know, if this guy had the money, could he have traveled to the United States in the knowledge that he would get the best health care, having contracted Ebola and knowing that he had done so from this pregnant woman? Of course, they turned him away. He told them he had come from Liberia, gave him antibiotics and turned him away. Now we have the global situation, which is just getting increasingly drastic every day. BBC reports Ebola outbreak, 5 infected every hour in Sierra Leone. A leading charity has warned that a rate of 5 new Ebola cases an hour in Sierra Leone means healthcare demands are far outstripping supply. Save the Children said there were 765 new cases of Ebola reported in the West African state last week, while there were only 327 beds in the country. So again, they're completely overwhelmed. They can't take in the staggering number of patients that this is impacting. And here at the end of the article, we see the scale of the disease is also, quote, massively underreported, according to the charity, because, quote, untold numbers of children are dying anonymously at home or in the streets. So this figure of Ebola deaths so far, 3,338, of course, many more infected, recovered, could be many more, because a lot of them just aren't being recorded. A lot of people are just collapsing and dying in the streets. So if you think it's bad now, I mean, imagine living in those West African countries. We had top German virologists talking about 5 million dead in Liberia, in Sierra Leone, because the virus is just going to burn itself out, according to him. It's just going to infect everybody. That's the only point where it's going to actually stop. Daily Mail Online reports 4 weeks to stop Ebola. 34 global organizations will warn international conference we have 1 month to stop the epidemic spiraling completely out of control. The international community has just 4 weeks to stop the Ebola crisis spiraling completely out of control. Organizations working in West Africa have today warned. So again, that ties in with the UN head, the top UN Ebola head, who said that this could be transmissible and it needs to be stopped now, as long as it isn't transmissible, according to our understanding, before it potentially mutates, goes airborne, which of course is a nightmare scenario in his words. UN Ebola chief, virus could mutate and become airborne if it is not controlled. We're going to get into that and more Ebola news. We're also going to cover some geopolitical stuff. We're going to go to your calls, 1-800-259-9231. This is the Alex Jones Show Live, Infowars.com for all the breaking news. Stay tuned. Lionel coming up in the third hour. David Knight in studio. Don't go away.
We're on